Magnesium is something that I talk to my patients about every day. Magnesium is important for over 300 different biochemical processes in the human body. And the question you need to be asking yourself is, am I one of the 60 to 80% of the people that are running at a deficit with this mineral? So let's just take a brief look at some of the causes and consequences of magnesium deficiency. We always like to look at diet first. If we can do it with food, that's always going to be best. So, we're not getting as much magnesium as we used to. One of the primary ways that we get the magnesium into us is by eating the vegetables. They pull it out of the soil, and that's how we get it. I don't have to tell you that we just aren't eating as many vegetables as we used to. The second part is that the way that farming practices are today, they're tending to deplete the soil of magnesium, so there's just not as much even if we are eating them. The second part we have a little more control over. A diet high in refined carbohydrates and sugary foods can deplete our magnesium. So these are your breads, your cakes, your cookies, your crackers, and your sweet junk food that are going to reduce the magnesium content in your body. The second thing I want to talk about is stress. So, as a physician in my office every day, when I do a review of systems on my patients, I would estimate well in excess of 50% of them put stress as a cofactor in their lives. Now, I'm talking about the long chronic, low-grade stress. So just the angst of day to day. So it might be anger, fear, worry. These are all stress, but there are other things that cause stress in the body too. They could be musculoskeletal aches and pains causing the stress. Or it could be poor diet, skipping meals, which kind of brings us back here to number one. The third group is huge. The third group are diuretics. So diuretics are things that cause you to lose water. And there are three different groups I want to talk about here. We're going to talk about caffeine. We'll talk about alcohol. And we'll talk about prescription medicines for high blood pressure. Caffeine, we know. We talk about coffee, tea, your energy drinks, cola drinks. These are all high in caffeine. The way that these can help cause magnesium deficiency is as you lose water, that's controlled by the kidney. The kidney also controls the magnesium balance. And as the water goes, the magnesium goes also. Alcohol, as some of you may know, if you have a little too much alcohol, it tends to dehydrate you. This is because alcohol causes a hormone change in the body, making the kidneys let go of that water. High blood pressure. As a physician, we're taught that first line with a patient with high blood pressure is to give them a diuretic or a combination of medicines with diuretic. So it might be a standalone pill or a combination pill. And they do a great job of reducing your blood pressure. They reduce the volume of fluid in the vessels, and that then reduces the pressure needed. So they do a good job with blood pressure at the expense of magnesium. If we now come in and take a look at some of the consequences of magnesium deficiency, you'll remember I said I talk about this every day in my office. As a neuromusculoskeletal specialist, I find that virtually all of my patients have a magnesium deficiency. Why magnesium? Why is that? Magnesium is a natural muscle relaxant. So whereas we need calcium to help a muscle contract, we need the magnesium to help it relax. So when we talk about muscles, of course we have the ones that we think about, our skeletal muscles. But we also have the heart, which is a major muscle. We have the blood vessels that deliver the blood to the body. And we also have the gut. The gut actually has a muscular layer to it, like the blood vessels do. So when we talk about the muscles here, and skeletal muscles, sometimes the muscle tightness is obvious. You actually can feel a spasm, or you have a facial tic, or you get a Charlie horse. But often what I find, though, is this tightness is a silent contributor to pain and inflammation in the body. Pain and inflammation, what do you do for that? If you're like most of us, you go and you look in your medicine chest and you take an Aleve or an ibuprofen or something like that. They're from a class of drugs that are called NSAIDs, non-steroidal anti-inflammatory drugs. And don't get me wrong, they do a great job of reducing pain and inflammation. The problem is they're also going to reduce your folate, your vitamin C, and your iron. Gut. I would say, in my practice, I find that the #1 reason for common constipation is low magnesium. Once we get that muscle to relax and let go, we can move the bowels. When we come over here to the blood vessels, if you have a blood vessel that can't relax, then you have a really small space for that blood to try and get through. So to compensate for that, the heart has to pump harder and increase your blood pressure. So what do we do then? We're going to give you prescription blood pressure meds, not necessarily just a diuretic, but some medicines. So we know that that comes back up here, but in addition, these blood pressure meds can cause significantly decreased zinc, potassium, CoQ10, sodium, and several others. That's pretty much true with all pharmaceuticals though, isn't it? Whenever you have a drug, you've got to look at the good and the bad, and you have to make a choice whether it's worth taking that medicine. While we're talking about the blood, there's something else that low magnesium can do. It can cause increased blood viscosity. Viscosity is stickiness of the blood. This is a factor if you've ever had a little stroke, a TIA, or actually had a major stroke. If you do, for sure, your doctor is going to go ahead and put you on a medicine, probably either Plavix or Coumadin, which is also known as warfarin. Coumadin is used more frequently and it's a lot less expensive, and so the insurance companies like that too. What this does, the Coumadin decreases your vitamin K. Now we've known for a long time that vitamin K was important for blood clotting, but in more recent years we've come to appreciate just how important vitamin K is in the bone formation. So if we go over here and we talk about bone, we see again calcium and magnesium working together. They work together to help form the cortex, which is the outer hard part of the bone. So when you're low in magnesium, you can see that can be a factor in osteopenia or osteoporosis. And as if all of this wasn't enough, depression. Low magnesium is implicated in depression. There have actually been several case studies that show magnesium is the primary reason that people have depression. Even if it's not primary, because there are many causes of depression, magnesium is a factor in depression. So let's say you go to your doctor and you say, "Doc, I really would like you to check my magnesium levels. I think it might have something to do with the way I feel." Probably they're going to pull up your most recent lab work and he's going to look at your serum magnesium and going to say, because that is commonly run, and he's going to say, "Mrs. Jones, your magnesium levels are fine." But unfortunately, only 1% of our magnesium is in our bloodstream, and we keep that very tightly controlled. So at all costs, we will keep what we need to in there, even if it means we take it out of the muscles or the bone. If you're a new patient and you've just been diagnosed, they may go ahead and give you a drug called an SSRI. These are serotonin selective reuptake inhibitors. Zoloft, Prozac, Celexa, this sort of thing. These have a host of side effects, as you may know, some really very uncomfortable. But in addition, they deplete a lot of your B vitamins. So as we look back at all of this, you can see how something so simple can be so important. If you'd like more information on which foods have the highest levels of magnesium, or which drugs can induce which depletions of which minerals, please go to the website www.YourHealthUniversity.com. We have a lot more information there available to you. This is Dr. Leslie Schmitz for Your Health University.